Dr. Anthony Fauci became a household name during the COVID-19 pandemic. As director of the National Institute of Allergy and Infectious Diseases, he was thrust into the spotlight. He became a key figure in shaping America's response to the virus. His decades of experience in infectious diseases made him a trusted voice for many. However, his pronouncements and decisions also drew intense scrutiny. Fauci's role was to advise the government on the best course of action. He had to interpret complex scientific data. He needed to communicate effectively with both policymakers and the public. This was a daunting task. The pandemic was unprecedented in modern times. The virus was new and constantly evolving. Fauci's recommendations often had significant consequences. Lockdowns, mask mandates, and social distancing measures were implemented based on his guidance. These measures were meant to slow the spread of the virus. However, they also had profound economic and social impact. The spotlight on Fauci intensified as the pandemic wore on. His every word was analyzed, his past statements were scrutinized, his credibility was questioned. The pandemic revealed the immense pressure and scrutiny faced by public health officials during a crisis. Perhaps no other issue sparked as much debate as the mask mandate. Early in the pandemic, Fauci initially downplayed the effectiveness of masks for the general public. He later reversed his stance, becoming a staunch advocate for mask wearing. This shift fueled accusations of inconsistency and fueled public distrust. Fauci's initial hesitancy stemmed from concerns about mask shortages for healthcare workers. He also cited the lack of definitive evidence at the time regarding the efficacy of cloth masks in preventing transmission. However, as more data emerged, Fauci changed his position. He acknowledged the role of asymptomatic spread and the potential benefits of even simple cloth masks in reducing transmission. This reversal, while based on evolving scientific understanding, opened Fauci up to criticism. Critics accused him of flip-flopping and sowing confusion. They argued that his changing guidance eroded public trust in health officials. The mask mandate debate became a flashpoint in the politicization of the pandemic. The mask mandate controversy highlights the challenges of communicating scientific information during a rapidly evolving health crisis. It also underscores the importance of transparency and clear communication from public health officials, even when the science is uncertain. One of the most serious accusations leveled against Fauci relates to gain-of-function research. This type of research involves manipulating viruses to make them more transmissible or deadly. The goal is to understand potential pandemic threats and develop countermeasures. However, critics argue that such research is inherently risky and could lead to a catastrophic accidental release. Fauci's NIAID-funded research at the Wuhan Institute of Virology in China, which has been at the center of the lab leak theory of COVID-19's origins. While Fauci maintains that the research funded by NIAID was not gain-of-function research, his critics allege a cover-up. They point to a lack of transparency surrounding the research and its funding. The debate over gain-of-function research is highly complex and technical. It involves weighing the potential benefits of scientific advancement against the risks of accidental release. The COVID-19 pandemic has reignited this debate and put Fauci's role in funding such research under intense scrutiny. The allegations surrounding gain-of-function research are serious and warrant thorough investigation. Transparency and accountability are crucial to maintaining public trust in scientific research and public health institutions. Section 4. Shifting Sands. Fauci and herd immunity. Fauci's pronouncements on herd immunity also drew criticism for perceived inconsistencies. Herd immunity refers to the point at which a sufficient proportion of a population is immune to a disease, making its spread unlikely. Fauci's estimates for the threshold needed for COVID-19 herd immunity appeared to shift over time, fueling accusations that he was manipulating figures to support his preferred policies. Early in the pandemic, before vaccines were available, Fauci suggested that herd immunity might be achieved when 60 to 70% of the population was infected. However, as the virus mutated and vaccines became available, he revised his estimates upward, ultimately suggesting that 85% or higher might be necessary. Critics argued that Fauci's shifting estimates created confusion and undermined public trust. They accused him of moving the goalpost to justify prolonged restrictions. However, Fauci maintained that his evolving estimates reflected the changing understanding of the virus, its transmissibility, and the effectiveness of vaccines. The herd immunity debate highlights the difficulty of making predictions about a novel virus. It also underscores the need for flexibility and adaptability in public health messaging as new information emerges. Section 5. Lockdowns are necessary evil. Fauci consistently advocated for lockdowns as a tool to slow the spread of the virus, particularly in the early stages of the pandemic. Lockdowns involve stringent restrictions on movement and social gatherings. While these measures were credited with preventing healthcare systems from being overwhelmed, they also carried significant economic and social costs. Fauci argued that lockdowns were necessary to buy time for scientists to understand the virus and develop vaccines and treatments. He pointed to the experience of countries that implemented early and strict lockdowns, such as China and South Korea, as evidence of their effectiveness in controlling the virus. However, critics argued that lockdowns were too blunt an instrument. They pointed to the devastating impact on businesses, jobs, and mental health. They also questioned the long-term effectiveness of lockdowns, citing the resurgence of cases even in countries with strict measures. The lockdown debate highlights the difficult trade-offs involved in pandemic response. It underscores the need for a balanced approach that considers both public health and the broader social and economic consequences of interventions.